And we're back with our political panel. Amy Walter is the national editor of the Cook Political Report. Dan Balz is chief correspondent at the Washington Post. And we're also joined by Bloomberg View columnist Megan McArdle. And we're also joined by Slate's chief political correspondent and CBS News political analyst Jamelle Bouie. Dan, I want to start with you. You heard Senator Barrasso. It sounds like a bit of a free-for-all. Senator Collins was a little confused about what's coming. What's coming on health care?
I think the one thing that Senator Collins and Senator Barrasso agreed on in those two interviews was that nobody quite knows what's coming. They're prepared for anything. The first question is, can Senator McConnell get enough votes to get the bill onto the floor? I think that's still in question. And I think that he has decided that the only way you answer that question is to take the vote. It may be embarrassing for him in the end if he can't do it. But I think he wants in one way or another either to have this debate or to get some closure to where this particular chapter ends. And then we'll see what happens after that.
Megan, how do you see the nature of the thing that they're debating? I mean, it's a Republican-only conversation at the moment. What's happening?
There is no bipartisan consensus on what to do, and in fact, there's no partisan consensus on what to do. Listening to Republicans talk about what they're going to do with this bill is a little bit like listening to George R.R. Martin talk about what he's going to do when the next Game of Thrones novel is going to be published. You're like, you guys, just admit you're never going to finish it, and just let us grieve, right? And I think that we've been following this for months. Now, we saw a similar process with Obamacare, right? It was dead, it was alive, it was like the unzombie bill of the century. But the difference is that Democrats knew what they wanted to do with health care, right? I mean, they have lots of, obviously, within the caucus disagreement about exactly what to do. They wanted the government to provide a universal guarantee of coverage. Everyone in the caucus, to a first approximation, wanted that goal.
The Democrats did.
The Democrats did. The Republicans, what they would like is for Obamacare not to have passed. Unfortunately, since they don't have a time machine, and as far as I know have not funded research into it, although perhaps they should, there's not really any way to achieve what the actual caucus agrees on. Part of the caucus wants, to cut Medicaid. Part of the caucus really wants to pass something called the Obamacare Repeal Act of 2017, which gets rid of the tanning tax. And part of the caucus really just wants to slash this, completely get rid of it, and put nothing in its place. And there's no way to sort of pull all of those goals together.
Jamelle, Anthony Scaramucci said the president was the best legislative person in the world, I think he said. But the president has had a lot of different messages on here, and his approach, Susan Collins said she hadn't heard from him. Right. What do you make of his role in this process?
I mean, the striking thing is that the president hasn't had much of a role at all, other than simply repeating the rhetoric of the campaign, we're going to repeal and replace Obamacare. It's very difficult to see the extent to which he or his staff have really been engaged in this effort. And I think that is also a critical difference with what happened with the Affordable Care Act, where at the critical moments, right, after the election of Scott Brown, for example, Barack Obama, the White House, worked with congressional leaders to ensure that the bill would survive and make its way through. And Trump isn't involved. Trump hasn't, the president has not even been able to articulate exactly what his policy goals are. He has not really defended the theory of the case here. So he's largely hands off. And I think had the reverse been true, that might have been some of what you needed to get Republicans together, just like some straight up leadership. But in the absence of that, these divisions, these differences, they take the fore.
Give us a sense of the politics here. If Republicans don't pass something that repeals Obamacare, is that more painful than passing something that's not very popular at the moment based on all the polls?
I think for a lot of Republicans, it's like asking the question of, do you want to chew glass or poke a needle in your eye? Which one is less painful to do? Nobody likes this bill. Voters don't like it. Megan's right. People within the caucus don't like it. Within the Republican caucus don't like it. Nobody really wants to vote on something, but they promised that they would vote for something. And then the most important thing then, if you're going to vote for something that nobody likes and you don't even particularly like very well as a member of Congress, how do you go out and defend it in the next election? And that's the real challenge here too. So there seems to be a piece where it's like a check the box for a lot of Republicans. We promised we'd do this. That's our number one concern. If we don't do it, our base is going to be upset and they're not going to turn out and vote for us. But if we check this box, get something done, we're just going to move on to things we like talking about and we'll be more coordinated on, like tax reform. The problem is that vote doesn't go away. Right. I talked to a number of Democratic strategists. They can't wait for 2018 to make the vote that Republicans have already taken on the House bill a central argument in 2018. Regardless of where they get on taxes, they still have to defend what they have or haven't done on health care.
And it's not just the substance of the bill there. It's very easy to say, if you're a Democratic strategist, that listen, the Republican Party spent the better part of an entire first year, doing nothing. And that's hard to push back against.
I think there's also the thing of, it's actually better for them if it doesn't pass, right? It's better for each individual person if they voted to repeal Obamacare and then nothing happens. Because, yeah, you can go out and campaign, as Amy says, but the fact is most voters have no idea what this bill is. But the minute there's something that's actually happening, Republicans 100% own what's going to happen. And since a lot of people won't like what happens, they're in a rough spot.
Dan, I want to switch to the changes at the White House this week. Give me your sense of within this administration, but then also historically, presidents have often said, if I just fix the communications piece, everything's going to be great. Is that what this is, or is there something else?
Well, you have a White House that from the beginning was built to be dysfunctional. This is not a hierarchical administration. I mean, I've said this before. If you drew a table of organization of the White House, you would have all of these boxes, but they wouldn't necessarily connect with anything, or many would connect only directly with the president, or none would connect directly with the president. He likes it that way. So, yes, they have a communications problem, but it's so easy for every administration, and we've heard it before, to say, if only people understood what we were doing, then things would be fine. It's much more complicated than that, and the president gets in the way of that. The agenda gets in the way of that. What we've been talking about on healthcare clouds all of that, and obviously Russia gets in the way of that. So moving Anthony Scaramucci, who's certainly a different personality than Sean Spicer, into that role and have a visible role, could make some small difference, but the problem is so much bigger.
And Amy, one of the challenges that the president's interviews and tweets seem to get in the way of his own agenda. That doesn't seem like it's changing based on Mr. Scaramucci.
That's right. That we've known from the very beginning that the real communications director in the White House is the President of the United States. And what he tweets sets the agenda. And so what you saw the day after Scaramucci was installed, we saw a whole line of tweets on Saturday from the president that were kind of all over the place, right? Whether it was the issue of pardons, there was a little bit about what he was doing down in Norfolk with commissioning a new ship, but really there was nothing there that was like a cohesive strategic message. This was Made in America week. That's what this week was started off to be. Certainly didn't end the week talking about the agenda. And that, you listen to Scaramucci talking to you, and he talked about we're going to get back to the agenda, we're going to get back to the agenda. The biggest difficulty in getting back to the agenda is the president's Twitter account, which they seem to have and this new White House communications director said, we just need to let him do more of it.
That's right, Megan. I mean, they've said, more from the president. Is that the solution?
It would not be my personal strategy where I appointed the czar of White House communications. I've often wondered why the White House doesn't have an aide who's just assigned to, every time the president gets a new cell phone, accidentally trip and break it. But, the fact is that's part of the problem. He hasn't really staffed up his administration. He doesn't have a policy agenda in a kind of traditional sense, right? He doesn't, when you see the lack of leadership on healthcare, he doesn't know what he wants on healthcare. He just wants it to be awesome. He wants people to like him. And that's sort of repeated over and over again, even on issues where, like immigration, yes, staffing up and doing some of these executive orders, but then beyond that, there's no kind of vision that you're going to be putting into place day by day, working with it, controlling the executive branch and making it do things. He doesn't have that. And so he focuses on controlling the news cycle and never thinks about, like, okay, you controlled this news cycle, but when you control news cycles with things that are bad for you, eventually that adds up into not getting an agenda done.
One of the things, Jamelle, that was in the news cycle this week is this New York Times interview and the president's clear view that the investigators working for Robert Mueller and the special counsel himself, Robert Mueller, are somehow compromised. That seems to have been that, plus some of the things his other aides were saying, a new strategy from the White House. Right.
I think in keeping with Megan's observation that the president wants to control the news cycle, and that's sort of where his skill set really lies, I think he's trying to wrestle control of the news cycle away from this investigation. And by making these allegations that the investigators are themselves personally compromised, I think his hope is to kind of sow doubt broadly among his supporters and also sort of make this the crux of discussion and not the actual substantive investigation itself. I want to add on to what Megan said and just emphasize that during the campaign, one of the President Trump's gifts, I guess, political gifts, was that he was everything to everyone. You could listen to a speech, you could watch him and sort of read in what you want to think. That is a disadvantage now that he's governing.
All right, we're going to have to end it there, and we'll be right back with some thoughts on Senator John McCain.